Okay, good morning, everyone. Hello, everyone. Thank you so much for joining us here today for Women's Health Month. Today, we are here to talk about women's pain and how long it's been overlooked. Like most women, I have a very personal experience with reproductive health pain. In the summer of 2015, while starting my career in New York City, I woke up on the floor of my local bodega, drenched in sweat, being dragged into an ambulance. Two male paramedics hovered over me and continued to ask me if I was pregnant. I had passed out from period pain. Even now, every month, I have days where it feels like barbed wire is tightening inside me. I've taken 2,000 milligrams of ibuprofen in 24 hours and still been in tears from the pain. Often end up on the bathroom floor in the fetal position, crying, moaning, or vomiting. Still, I've put on a blazer and gone to work. I've sat in committee hearings, nauseous from the pain, quietly breathing to make my way through it. I've given speeches at rallies and run town halls while my body was in full revolt. I smiled for photos while silently wondering if I might faint right then and there. It wasn't until my mid-20s that I started researching and reading the very limited studies that exist on this topic. Period pain can be as bad as the pain women experience during the second stage of labor or even a heart attack. In fact, about 15% of women have period pain so debilitating that it disrupts work or school. That is no small number, and yet we are told to suck it up. Across the U.S., millions of women have to choose between working through unbearable pain, losing income they can't afford to go without, or tapping into a very limited number of sick days that they won't have if they have the flu or a doctor's appointment. For low-wage workers, the choices are even more limited, with no work from home or sick leave options. When I woke up on the floor of that bodega in 2015, I was 23 years old and terrified that asking for time off would hurt my career. Now I'm a member of Congress with the power to do something about it. It's why during Women's History Month, I've introduced legislation to give workers up to 12 days of paid leave a year for reproductive health. This would cover period pain, yes, but also menopause symptoms, IVF, miscarriages, endometriosis flare-ups, and more. And it's not just for women. Men can leverage the policy to get a vasectomy or fertility treatments. It's a policy that's inclusive, it's smart, and it's cost-effective. And that's not all. My legislation also includes bills to finally fund studies into gynecological pain management, including IUD insertions or cancer screenings. The package also incorporates a bill that would direct federal agencies to finally research PMDD, a severe form of premenstrual syndrome that can cause severe symptoms of anger, irritability, depression, and anxiety, as well as a significant increase in suicidal thoughts and behaviors. These are medical issues that need to be talked about, treated, funded, and acknowledged as real. I may be the youngest woman serving in Congress, but this pain is so much older than me. Older than my mother, older than my grandmothers. They endured it in silence. Future generations should not have to. When we start speaking honestly about this pain, and when we finally pass policies that recognize it, we can change what's possible for every generation that comes after us. This Women's Health Month, let's destigmatize the pain and suffering that too many women endure in silence, from period pain to endometriosis to the newly recognized PMOS. The more we talk about and uplift women's stories, the louder the public call for money, for real research will be, and for legislation that will actually improve things. Thank you, and now it is my honor. We're going to change the schedule a little bit, and I'm going to pass it over to Congresswoman Adelita Grijalva. Thank you.
Thank you so much. Buenos dias. Good morning. I am Representative Adelita Grijalva, and I'm proud to stand here alongside my friend from Arizona, Congresswoman Yassamin Ansari, to champion a long overdue reckoning in women's health care, the health, equity, and rights, or HER agenda. As the first Chicana elected to Congress from Arizona, I'm here to speak to the thousands of women in Southern Arizona who are tired of being ignored. They are tired of having their pain minimized. They are tired of a healthcare system that treats women's bodies like an afterthought. For generations, women have been told to tough it out. And in fact, often tough it out to their own detriment, ignoring and being dismissed when serious life-threatening health issues arise. And while the system is broken for all women, it is in a full-blown crisis for Latinas. The nationwide 17% of Latinos lack health insurance, more than double the rate of white Americans. Over 20% of adult Latinos in Arizona have been forced to completely avoid medical care because they simply cannot afford it. And Latinas are the backbone of our workforce, and yet they're disproportionately concentrated in low-wage and hourly jobs that lack flexible sick leave. Forcing a worker to choose between paying her rent or losing a day pay to recover from a grueling gynecological procedure is not a choice. It's an economic violence. Las mujeres sostienen nuestras familias, nuestras comunidades y nuestra economía, y merecen respeto y acceso a buena salud. And right now, women's health and their bodily autonomy are under an absolute assault. Today, my daughter has less reproductive freedom than I had, less reproductive freedom than my Nana had. Think about that. The HER agenda directly targets those failures. This agenda pays needed paid leave for conditions like severe menstrual pain, endometriosis, and recovery from procedures. This ensures that our working mothers and daughters do not lose their income for basic bodily care. It also includes a pain management study to investigate the institutional barriers that prevent women from receiving adequate pain management during routine and painful screenings. We are done being gaslit in the exam room. Health is not a luxury, and our pain is not an inconvenience. It is time to pass a healthcare agenda that truly sees us, respects us, and protects us. It's time to acknowledge our country's history of systemic injustice in women's healthcare and needs. And I thank Representative Ansari for leading this charge. Muchísimas gracias. Adelante.
Thank you so much to Congresswoman Grijalva for her powerful leadership on this. It is now my honor to introduce another leader on reproductive health care issues and so much more, Congresswoman Rashida Tlaib.
Thank you so much to Representative Ansari for her incredible leadership and her vulnerability as a member of Congress to speak about her truth and her pain. I am proud to say I founded the Congressional Mamas Caucus to break the silence around women's health and create space for honest conversations about reproductive justice, and that's why the HER agenda is so important today. We know the legislative package takes meaningful steps to close long-standing gaps in women's health care. I know that many of you understand that we're sick and tired of women having to be expected to say, suck it up, or still perform at the highest level. They are expected to show up to work despite incredibly painful periods and sit through meetings after being denied competent health care. And for far too long, women's pain have been minimized, ignored, dismissed, and even politicized. And so again, it's incredibly important that we all come here today. My colleagues, I do remind them I'm on a list of 14, but they forget that 6 of those are sisters. And many of my sisters, from endometriosis to IVF to miscarriages, menopause symptoms, which I am the first to go through, all of that, we had that sisterhood. Many women do not have that. And they expect us to be able to create space so they can actually be supported during these really, really important times. We have to guarantee paid leave for reproductive health. That is the minimum. No one should have to choose between their paycheck and their health to be able to manage that kind of incredible pain. It would direct the Department of Health and Human Services, as Representative Ansari said, to study the barriers between pain management during procedures, because no one, again, should be simply told to take ibuprofen, and that has happened to me several times, and to endure the pain. It would invest in research for PMDD and other conditions that have been overlooked and understudied. This is about listening to us, listening to women when they say they are hurting and that they're in so much pain, and rejecting the dangerous idea that suffering is simply the price of being a woman. And even jokes aside, I've heard it all, and people joking away that pain. And it hurts to listen to people thinking that it's okay. That again, is just again the price of being a woman. We don't have to live this way anymore. We're in positions like this that Representative Ansari can bring her own lived experience here to move with the urgency that is needed and what women deserve in our country. And most importantly, they always deserve dignity and respect. Thank you.
Thank you so much. Now, none of this work would be possible without incredible partners and organizations who helped not only through the legislative process, but of course have been doing advocacy for years and will continue to help us get this over the finish line. So our next speaker is from the National Organization of Women, and that is Kim Villanueva. Thank you so much.
Thank you, Congresswoman. May is Women's Health Month, and that means confronting a reality that millions of women know all too well. Women's pain is still often dismissed, minimized, or treated as inconvenient instead of a medical priority. I know this personally. For years, I lost 1 or 2 days of work every month to hormonal migraines, nausea, and severe period pain. And when I did stay at work, I wore sunglasses to block the fluorescent office lights. In my 40s, I went on birth control just to manage the symptoms, even when I was entering menopause. But my story is not unique. Women with endometriosis, menopause symptoms, and other reproductive health conditions are constantly told to tough it out, while their quality of life, economic security, and health suffer. That's why NOW proudly supports the Health, Equity, and Rights, or HER Act, or agenda. This legislative package addresses long-standing inequities in women's health care, focusing on pain management, research, bodily autonomy, and workplace protections. The Reproductive Health Care Leave Act would provide up to 12 days of paid leave for reproductive conditions and procedures. No one should have to choose between their paycheck and their health. The Gynecological Pain Management Study Act recognizes something women have known for generations. Our pain is real, and it can no longer be ignored. And the Premenstrual Dysmorphic Disorder and Awareness Research Act would expand urgent research and education around a condition that is too often ignored. The HER agenda sends a clear message. Women deserve dignified health care, evidence-based pain treatment, and workplace protections that recognize our reality. We are done being dismissed. We're done being gaslit in exam rooms, and we're done being told, just take a Tylenol. And we're done accepting a healthcare system that treats women suffering as normal. NOW is proud to support the HER agenda and move the conversation beyond procedures to the fundamental right to patient-centered health care. Thank you.
Thank you so much, Kim. I am honored to introduce our next speaker, who is Stephanie Jacques.
Good morning. I am Stephanie Jacques. I am a reproductive rights advocate, cultural critic, and a writer. I talk about reproductive rights a lot, and people ask why. Why do you make it so personal? Because it is personal. I had a miscarriage in a red state, and I've worked alongside Planned Parenthood and Planned Parenthood Tennessee, and I've seen what happens when women, especially Black women, don't have access to the care that takes their body seriously. I've watched what happens when women's health gets treated as negotiable. It's about whether our lives are considered worth protecting at all. And I've learned that this medical system was built with us not in mind. We have been undertreated, underfunded, and underbelieved for generations. Representative Ansari wrote about the passing out in a bodega, and they asked if she was pregnant, as if that's the only thing that would cause a woman pain and suffering. So many of us have a version of that story. Told to push through, told it is normal, told to come back when it gets really, really bad. But having paid reproductive health leave for menstrual pain, for endometriosis, for fertility treatments, for IUD insertion is necessary, because women should not have to choose between having health treatments and having an income. We have been penalized economically for our biology that has been ignored clinically. Reproductive and women's health is a survival issue, an economic issue, and a dignity issue. And every time one of us comes up, tells our truth, and tells our story, it makes it harder for us to be ignored. And it makes it harder for anyone to look away. So I would say, I'll keep showing up, and thank you, Representative Ansari, for keeping on showing up, for telling your story, and for having the HER agenda. Thank you.
Thank you so much, Stephanie. Very powerful words, and thank you for your long-standing work. Our final speaker is also named Stephanie Yost from Reproductive Freedom for All.
Good morning. On behalf of Reproductive Freedom for All, I'd like to thank Rep. Ansari for her leadership and for the Her agenda and for sharing her personal experience to bring light to the generations who have suffered because our pain was not taken seriously. You know, at this moment, we find ourselves fighting against ongoing efforts to defund healthcare, to take away bodily autonomy, and to defend our most fundamental freedoms. But we cannot lose sight of the future, of a future which listens, acknowledges, and responds to our reproductive health needs. Reproductive Freedom for All President Mini Timaraju summed it up with this: for too long, people have walked out of their doctor's office or the emergency room without answers, without treatment, and without relief, especially women, people of color, LGBTQ+ people, disabled people, and immigrants. This legislation is a step towards addressing the systemic barriers that prevents patients from getting the care that they deserve. At Reproductive Freedom for All, we're thankful for Rep. Ansari's leadership, and we support the Her agenda and the patients who will benefit from it. Everyone should have the freedom to make their own personal decisions about their lives, bodies, and futures.
Thank you so much, everyone, to all of our speakers today, to Congresswoman Grijalva and Congresswoman Rashida Tlaib for being here. Sorry, this wind is... Appreciate it. It has definitely been an honor today to be surrounded by women's healthcare advocates who have been doing this hard work on the ground to raise awareness about this issue for years, as well as my colleagues here in the House who have been championing this issue alongside me. This group here knows, as well as I do, that nothing will change if we do not speak up. Recently, national news was made when PCOS, which was known as polycystic ovary syndrome, was re-recognized as PMOS, polyendocrine metabolic ovarian syndrome. This hormonal and metabolic disorder, affecting roughly 1 in 8 women, has been chronically underfunded and understudied for years. Only now, in 2026, is science finally catching up to women's pain. And that's because women, like the one standing here with me, have refused to be silenced as friends, partners, and even our own doctors have told us when we are being overly dramatic. As the youngest woman in Congress, I am fighting for women's health outcomes, especially in communities that experience higher instances of misdiagnoses, medical incidents, and even death. Together, we will keep raising our voices, and behind those voices, I'm pushing for real legislation that can pass, bills that appeal to Democrats, independents, and Republicans, and people of all genders. I know you will keep fighting with me. Thank you again, and we will open it up to any questions if there are any. Absolutely. We are talking to everyone about these bills. I think these bills could not be more bipartisan. If you look at the data, it's very clear that women's reproductive health care has long lacked the same level of funding and research that men's reproductive health care has. It's stark, the difference. And women of all political parties are affected. If you're a woman, you are affected by this. And so we look forward to having Republican support for these bills as well, especially the ones that have to do with research to make sure that we're getting science-based, data-driven recommendations from the National Institute of Health and other relevant departments. Saw another hand before, no? All right. Thank you all so much. Appreciate it. Thank you all. Yes.
Like stand out the Capitol in the background.
Should we stand? Maybe.
I mean, let's stand by the podium again if it's not. I mean, the sign's there, so either way.
Okay. Perfect. So maybe everyone scoot in.
This is your sign. Do you want it?
Oh, it's okay.
Oh, good.
Oh, here we have two. Okay.
Yes.
Great.
Yes.